And
Yeah.
I also am really interested and passionate, and I feel like enough of it doesn't happen of just talking to people in plain language, in a language they understand. And I feel like COVID has highlighted that a little bit too. Where uh, public health professionals, researchers, they would get on the news and they're talking about stuff, and they're like getting upset when people aren't
Just
wearing
talking.
masks. And like, but what you're saying makes perfect sense to you. It doesn't make perfect sense to the rest of us. you know,
Yeah.
you're not using the right language. And I feel like that's so missed sometimes. Everybody's all about like I remember when I was in school, it's all about these research studies, and we go to journal club and we're talking about p values, and if there's enough people in the study, is it sufficiently powered? And I'm just like, yeah, like how much more counting do we need to do? We know it's a problem. Like, how are we going to fix it? Like, I don't ever remember reading about like what was the dissemination program well done, and is it written at the literacy level that everybody gets? No. No, we didn't have too many discussions about that, but the p value was important.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this.
Welcome to the Public Health Millennial Career Stories podcast, episode number 42. Hi, everyone. Omari Richards here. Thank you all so much for joining me today. Before I say anything, definitely be sure to subscribe, leave a like, leave a review, share this with a friend. I appreciate you all tuning in and week out to listen to me interview people around podcast stories. I just wanted to say, like, if anyone is interested on being on the show or knows anyone who might have a valuable story to share on the show, definitely just reach out to me, and I would love to get that person on the show and share that story and just continue to build and doing these things. Just really enjoy having these conversations, and I'm glad that people take value from it and I can have these conversations and just share it naturally, and you all are enjoying them. So without further ado, I hope that you all enjoy today's episode. Today, we have a public health professional with lived and work experience in Guyana, schooling experience in the USA, and now being employed in Montreal, Quebec, Canada. She has a Bachelor's of Science in Community Health from the University of Maryland and a Master's of Public Health from Emory University. She's the host and creator of the Good Health Café podcast and blog. Check it out on all podcast platforms and on Instagram at the Good Health Café. She works at McGill University as a project administrator for the School of Population and Global Health. We have Nikita Boston-Fisher, MPH, PMP, CHES. Welcome to the show.
Thank you for having me. It's a pleasure to be here.
Yeah, my pleasure to have you. And I think you're the first person on the show with a PMP, so I'm excited to dig into that a little bit later
Oh,
on.
cool.
Yeah, definitely. You're definitely the first person from Guyana, also. But yeah. So how are you doing, and how are you coping during these times?
I'm doing well, and honestly, I'm coping pretty well as well. Working from home was an initial adjustment in boundaries and stuff,
Mm,
but I've always wanted to work from home. So I feel like I finally I finally got it to happen. I am not missing the commute. So I used to commute maybe 45 minutes each way, and I used to take public transit. And so the fact that I don't have to do that anymore or not be on a bus with other people, I count my privilege, and I'm good. And I was able to use that time, the commute time back and forth every day. It adds up.
mm.
And I've filled it with other things. I started my podcast, and now I even make scented soy candles. So
Oh,
I'm
okay.
enjoying it.
Yeah, before we get into it, tell me a little bit more about your scented soy candles. Like, why do you get into that? How do you make them?
Why did I get into that? Because I like scented candles, but then I'm always one of those people, if I feel like there's any remote chance something can kill me, I avoid. And I had seen on the internet that apparently, like the regular way, I think it's made with paraffin wax, and that might
Mm.
be carcinogenic. So I was like, you know what? Why don't I just try making my own? And I tried making them, and it's really fun. So I continued.
Okay, awesome. Do you have like a favorite scent?
I love vanilla. I like I've always loved vanilla scented things, but of the scents that I've bought and tried so far, I like lemongrass as well.
Yeah.
Like lemon citrusy type things.
Yeah, fair enough. Fair enough. Okay. So,
Mhm.
how do you identify, and then tell us a little bit about your personal background?
I identify as Black Guyanese female. My personal background is I was born and raised in Guyana. I did up to high school there, so I finished high school up to A levels. Then I went to the US for my bachelor's and my master's. Went back to Guyana for a bit. Now I'm here in Canada. So I've been very nomadic my adult life. Yeah.
Yeah, absolutely, and that's great. I feel like having those different experiences, those different lived experiences, definitely help shape your mind and like how you think about different things, and it definitely gives you a unique perspective when it comes to public health. I feel like,
Oh, for sure.
yeah, awesome. So, what does public health mean to you?
Public health means prevention. It means quality of life. It means joy and happiness. That's what I think. Because I've always thought when when people ask me about public health and what is that, I always say, well, it's like preventing someone from getting sick before they actually get sick, so you don't have to fix it. And growing up in a developing country, I felt like that was essential. We didn't have all the fancy stuff that you have overseas, so why not work to address the problems before they become bigger?
Yeah, yeah, awesome. Thank you for sharing that. So you were assistant to an epidemiologist at the PAHU, or Pan American Health Organization in Guyana, and this was before your bachelor's. So how do you like get this or like think about this or anything like that? Tell me about that.
Right. So in high school, after we finish O levels or CXC, for those who would know what that is, you have to do, well, you don't have to, but you have this option to do what they called work study. So we would go and we'd get assigned to different organizations around the country to get work experience, see what it's like. And I had already known that I had an interest in public health. And so I asked if I could pick my own placement. And I called the PAHO office and I said, this is who I am and this is what I want to do. Would you be willing to take me? And they did. And I got to shadow this wonderful epidemiologist around for 2 months, observing him do his work. It was great.
So how did you know about public health before? Because that's not something that is common among people just in general.
Yeah. I've always had an interest in health from the time I've known myself. I've always been afraid of dying, like germs and stuff. And I was a voracious reader. I would read the newspapers. And even like when we're driving to school, I would see these vehicles and they would say like Ministry of Health, or you would see one that says PAHO or FAO. And I'd be like, what's PAHO? What's FAO? Then I'd go and I'd read. And so I discovered that there was this organization called the World Health Organization that did all these things about health. And there's food and agriculture organization. And I just started reading and I was like, this sounds fascinating. This sounds like a career I want to have. I want to learn as much as I can, as possible as I can about it. So
Okay.
kind of I learned about it from observing my surroundings, looking at vehicles that I saw in the street, looking at things I saw in the newspaper, and then just exploring and digging. And then once I started talking about how I was interested in public health, because I should say at first, like most people, I wanted to be a doctor. And then I was like, oh, cool. I get to like work with the whole population and not just one person at a time. And I started talking about this stuff. And I discovered that I had an aunt, my mom's sister, actually had a master's in public health. So when I started talking about this stuff, they're like, oh, don't you know that your aunt has this degree? You should talk to her. So yeah, my aunt explained more to me about it as well.
Okay, that is awesome, and that's not a typical story of someone getting into public health. Definitely, so that's awesome that you knew about it so early on. That you had family members who
Yeah.
actually got the MPHs and like had experience in it. I just wanted to ask, like, so PAHU, Pan American Health Organization, is kind of like the Health Organization for Pan American countries. And you said another organization was that FCA, FTA,
FAO.
FAO, and what is
Yeah, which
FAO?
I think Food and Agriculture Organization.
Okay, so I'm guessing that's like a Guyana.
No, that's one of a UN agency as well, one of the many UN agencies. I think that one is based in Rome or something like that.
Okay, I've never
But
heard of that.
yeah. Yeah, they would have all these vehicles driving around, and they're always white, and then they have their thing printed on it. Like, who are these people? They seem to be getting treated differently from the rest of us. What's going on here? Like VIPs.
Okay, it's awesome. Okay, so you left Guyana and you came to the US to get your Bachelor's of Science in Community Health at the University of Maryland. What was that process like, I guess, looking at universities in the US and then choosing one to go to?
It was interesting. It was overwhelming a little bit, but also fun because I always liked research.
Mhm.
And growing up like an only child, there was like nothing but time, to look things up. And so I knew, having had the experience at PAHO, having an aunt who had a master's of public health degree, I knew like, okay, I want this career in health, and to work in public health, you probably need this master's degree. Okay, but you have to get a bachelor's first. What am I going to study? So I thought, ooh, I wonder if there are any bachelors of public health or community health. So that's how I did my search. I started looking online for universities that offered any sort of basic health degree, and I had narrowed it down to two. And it was, both were in the DC area. It was American and University of Maryland. And my grandfather was visiting the States at the time. And I asked him if he could go look at both of them and tell me what he thought. And he looked at both. He went to both campuses and he said, I think you'd be, I think you'd like either one. But the children on Maryland's campus, they just look so happy. I think you would be happy there. And it's huge. So if you change your mind and decide you want to do something else, they probably have a major that you want to do. So that's it. That's how I picked it. I arrived on the campus, sight unseen, and I loved it. Every
Yeah.
minute of it.
Well, that's glad to hear that you did love it, sight unseen. I feel like that's also something that I did. I never saw University of Tampa before I came to the US and went to University of Tampa. So that has definitely taken I guess a dive off the deep end, and I'm glad that it worked out well. You know,
And
and
I
I'm
was, oh, sorry, go on.
no. You go ahead.
No, I was going to think, and it was so huge, like so huge. And I don't know, it was very overwhelming, but it took a little while to adjust. But by
Mhm.
the end of the first semester, I was like at home. I remember when I saw where my dorm was and where all the classes were, I went to the student union and I said, oh, well, what time does the bus pass to pick you up for your, for your, to go to drop you off at the classes? And the person's like, oh no, honey, you have to walk. I was like, what? The campus is so big, it has its own zip code. I'm like, what do you mean I have to walk? But yeah, yeah,
Okay.
it
Yeah.
was it was
Um,
fun. And then of course, being an international student, everybody's like, where's your accent from? Where are you from? And then of course nobody knows where Guyana is, and they think you're saying Ghana, and it's just like a whole thing. But you get accustomed to it.
yeah, fair enough. And for those who don't know, where is Guyana?
It's in South America. It's on the northern tip of South America, bordered by the Atlantic Ocean to the north, Brazil to the south, Venezuela, and Suriname, wedged in between those two.
Yes,
Only
yes.
English speaking country in South America.
That is correct. That is correct. And
Yeah.
fun fact, they say we say curry chicken in Trinidad and Tobago, and they say chicken curry
That's
in
right.
Guyana, which is an incorrect way to say it. Just putting that out there for the world to know.
Yeah, it's like the peas and rice versus rice and peas debate between Jamaicans and Guyanese.
Correct,
Yeah.
correct. Okay. So in your undergrad, you were CHES Leadership Internship Program intern at the University Career Center at University of Maryland. So how did you come across this position, and then what did you do in this internship?
Well, I was in Student Government Association, and the advisor for Student Government Association said, oh, Nikita, you should apply for this. I think you would be great. I think you would enjoy it. And so I did. And that's a note for people, is like, find mentors and recognize where people are mentoring you, and you like don't even know that that's what's happening. And that guy, his name was Craig, and he was just there for me from day one, always just suggesting things. And so he suggested the Chevy Chase program. And what it was, I think, one semester of a leadership course, 1 or 2 semesters of a leadership course, and a 1 week study abroad trip in Czech Republic to study what leadership is like over there. So, yeah, we did an internship. So there was a 1 semester internship on campus. There was a leadership course we needed to take, and then we did the trip to the Czech Republic. So it was like my first real job, I guess. I had the PAHO thing, and then I remember for this to apply, you had to get a resume. I'm like, resume? What am I going to put on a resume? I'm a freshman. There's nothing to report. But they help you with all that. You go to the career center and they help you think about your experiences and write it down. Yeah.
Okay, that's awesome. That's awesome. And I didn't expect you to say that you had to go to Czech Republic, you said?
Yeah.
That's
Yeah.
awesome. What was that experience like?
Ooh, it was very interesting. My first time in Europe at all. And it was really cool. So I think there were 12 of us in the program plus the
Mhm.
2 staff. And we went to a university in the Czech Republic. We met some Czech students, and then we also toured the country for a week. So that was fun.
Wow, that's awesome. Which year in undergrad were you in?
Okay, so the application was, I think, at the end of my second semester. And so we did the trip in second year, so sophomore year, because you applied like in the summer and then you went the following spring.
Okay, that's really awesome experience. So I'm glad that your mentor put you onto that. That's awesome.
And what was fun about that too is that afterwards, after going through the internship program, I actually got hired to help with the next cohort of students. And instead of Czech Republic, those students went to Uganda. I was like, man, that would have been cool. Yeah.
Yeah, that is really awesome that they have this kind of programs there for people to get that kind of experience. So that's awesome. So after this, or the next position that you had was an education and research intern at the Lupus Foundation of America. So how did you come across this internship, and then what do you do in it?
Okay. So as part of, to get your bachelor's in community health, we had to do a full semester internship. So 12 credits, no class, just full work experience. And so the school held a fair for all of us, community health students in the cohort who were at that stage in the program. And the different employers, well, no, that's not true. Yeah. So there was a listing of places where students had gone before. We
Mhm.
had to apply and then go out and do the interviews. And so I looked at the list and I applied, and this sounded really interesting. And so I went on the interview and I got the position, and I did that in the summer.
Okay, awesome. And what did you do in the position?
Ooh, what did I do in the position? Oh, right. We were preparing for a huge lupus conference. And so I helped with that, interny type things, get the binders ready. I did research on, they wanted to do interventions where you would drop off lupus pamphlets at barbershops and hair salons because, people talk, you have a captive audience there. And so I helped create the brochures for that and come up with a strategy for how we drop them off, look for the places where we would want to put them, stuff like that.
Okay, awesome. I wanted to ask, like, considering that you knew that you wanted to go into like public health and everything like that, was your school's like undergrad community health program, was it like a big program, big cohort of students?
No, it was very small. Oh my gosh, how many people were in my cohort? I would say maybe 40. It
Okay.
was not a lot of people. It was nice and small and intimate, which actually ended up being culture shock for me when I did my master's, and my cohort was massive, like 400 people. I was like, what? I thought they said that master's programs were going to be smaller than undergraduate programs. But again, at that time too, nobody really knew what public health was and stuff like that. So it was a lot quieter. In fact, when I started my bachelor's, the school was called the College of Health and Human Performance. And then during the time that I was getting my degree from the school, they became like a full-fledged school of public health. They changed the name. They had a whole rebranding. We all got t-shirts. Everything was great. And so then I think the program probably grew from there. And now they actually have 2 different bachelor's programs in public health. I think one is called Public Health Science and the other one is Community Health.
Okay, that's awesome, and thanks for sharing that because
Mhm.
I feel like just going into undergrad, I feel like most people are not going in there for like public health for the
Yeah, no.
most part. So that's
No,
good to know.
no.
And also during your undergrad time, you were a health policy and practice intern at the American Public Health Association. So how do you come across this position, and then what are you doing?
I really wanted to work at APHA because I knew that it was, the premier public health organization. And so I just basically went on the website. I saw that they took interns. And so I applied. I called, well, yeah, would you really willing to take me? I submitted my resume. And then they called me in for an interview and they said, well, which one of our sections would you be interested in working in? And it went from there. And I spent a semester with them.
Okay, and what kind of things did you do in that internship?
I did that internship in the fall. So one of the big projects was helping to prepare for the APHA annual meeting, which happens in November. And as an intern, we got to go. So preparing for that meeting is a huge, huge task. It's thousands and thousands of people. So they actually have a staff for that, but they allowed the interns to help with some aspects. And then also I created my own project where I was working on the Get Ready program, which is like flu preparedness and answering questions. There was like a webinar where people can write in questions for Get Ready Flu. And then us interns, we'd kind of look up the answers and draft the answers to be put on the website and stuff like that.
Okay, that's awesome. And that's definitely some key information for anyone who wants to get some internship experience in your undergrad. Go on websites like APHA and other organizations, see what internships they are, or just call people and reach out for opportunities there because that's an awesome experience, especially as an undergrad student.
Definitely. Even if they don't have like a formal internship program, you can just send somebody an email and say, hey, would you be willing to take me? Well, the pro and the con is too that people love students because it's free labor. But I know that there's also a movement, which I highly support, of paying interns. But yeah, most times people are into, sure, you want to come and do this stuff that I have sitting off the side of my desk, by all means. you know?
Yeah, they always want people to file stuff and stuff like that,
Yeah.
right? Yeah, so there's definitely opportunities out there once you put yourself in that position to get those opportunities. So you graduated with your bachelor's, and after this you got your you got certified health education specialist certification. So what was your thought process for getting this?
The professors recommended it. They said, so our community health program was more like a health education program. We did a lot of health promotion, health fairs, things like that. And so it was definitely something that the school recommended. So when we were winding down our program, they said, look, you guys, you've met all the requirements to sit for the CHES exam. So we'd recommend that you take it. And so I signed up. We actually did the CHES exam right there on campus. And then so by the time we graduated, we had it.
Okay, and that's awesome, and that's like a certification that a lot of people I know have gotten a lot of value from, and that is the one that I would suggest over the CPH. Just putting that out there. But yeah, so did you know that you wanted? Well, I guess you did know you wanted to go on and do your master's of public health, or did you think about like doing a master's of like health education or a master's of science and like something else, or was public
No.
health?
Public health was the end goal. I knew that, well, public health is the field I wanted to work in. Apparently, to work in the field of public health, you need this master's. So that was like my single solitary mission, is that I need to get this degree. So
Okay. Yeah, awesome. And what made you want to choose to go to Emery, or was that just by happenstance?
oh. Well, it was a mix of things, to be honest. One, its location in the south of the United States. So I wanted to go south because having experienced the north in winter, remember I told you I came as an international student, that the cold was not what it was cracked up to be. So I literally pulled up a map and I was like, I'm going to apply to schools south of North Carolina. And so I applied to everything in the bottom half of the country. And then of the schools that I applied to, what was really hard for me to do was pick my concentration. I really couldn't decide. So I was very much, should I do like behavioral science, health education? I don't know, but I kind of did a bachelor's that was related to that. And I saw that a lot of the master's programs were saying, oh, and then when you finish, you can sit for your CHES. And I was like, oh, but I've already done the CHES. So maybe, maybe I need to pick something else. And so Emory had global health, and I was interested in international development, or at least in Caribbean development, because I hadn't intended to remain in North America. So I was like, okay, well, I guess I could go do this global health because maybe they'll talk about stuff that's not US specific. And so I picked global health because I was
Yeah.
hoping to get like what I thought would be more general knowledge that I could apply to CARICOM, when I go back.
And was that the case?
No.
So what was the experience like then?
Honestly, I thought it was very basic a little bit. Like you talk about gatekeepers and, you can't just show up in somebody else's place and tell them how. This seems obvious. I don't need to pay to tell you that I shouldn't just show up and behave like I have all the answers. But yeah, so it wasn't quite what I expected. But yeah.
And in hindsight now, would you go back and do a different concentration, or do you
Oh,
think
absolutely.
yeah?
Absolutely. Without a doubt, I would not do global health concentration. I would pick another concentration because I think the main public health arms that you normally have, like environmental health, epidemiology, biostatistics, you can take all that training and apply it in an overseas setting. I felt like global health ended up being a little bit generalist. And that was something that they did tell us when we were starting. It's like they were like, make sure you pick a lot of methods courses, like make sure you do monitoring and evaluation, and make sure you do epi. So I guess they too kind of realized it was like, well, what exactly is like your skill set for sure when you leave with a global health degree.
Okay. Thank you for. Please share, please.
I was going to say, oh, but I did have to pick a concentration in global health. And I think that was also something that kind of drew me to Emory. Was I knew I was interested in maternal health, and they had this concentration in reproductive health and population studies. So in the global health degree, you did have to pick from one of four options. It was nutrition, reproductive health and population studies, community health science, and I can't remember what the other one was. No, like community intervention, something like that. Some community something. I don't remember. Yeah.
And that is completely fine. So going into your master's of public health, like you said that you want to work in the field of public health. Did you know what exactly you wanted to do, or you had no idea, or you had a bit of an idea?
I knew planning and designing health education programs was interesting to me, and also respectful and compassionate care in hospital settings was also very interesting to me. Because growing up in the newspapers, I would read about like patients being abused by nurses or being yelled at, and I was like, what? How could this be? People are sick. You're supposed to be nice. And I kind of wanted to understand, well, what are the larger health systems processes at play that would allow for these things to happen?
Okay.
Oh yeah. So yeah, there were a couple of reasons why I chose Emory. And yeah, and Emory had like people who did stuff in health systems. And so I was really interested in learning more about that.
Okay. And did you gain that kind of knowledge that you thought you would?
I would say generally, but not as specifically as I would like. Yeah, they touched on it. Like we had a class on health systems performance, but I never got to like the whys. Like what are all the stressors on the system that cause these things to happen? And I guess that you only get that when you're back in the field, in the trenches, I suppose.
Okay.
Because the teachers, they're like you, they're hypothesizing. And the specific interest I had, which was disrespect and abuse, particularly during childbirth, was not something that people seemed to be aware of at the time. Like I'd say it and people look at me like I have 10 heads. Like, oh no, it's a thing. but again, that's a perspective I bring, I guess, having lived somewhere else to be able to talk about that they would not have had. Yeah.
Yeah, and I think those are the kind of like enriching experiences that you have to like you can get from other people in your program. Just have them having that kind of lived experiences and having those different experiences that are kind of like just mind blowing, like outside of like what you expect to be
Yeah.
issues or norms or whatever the case might be. So that is fascinating. And like I just like to say that you definitely have to connect with like people in your program because you can learn so much from them just
Hmm.
outside of like classes and whatnot.
Oh, yeah. And I also started one thing that I started thinking about during my program and after too was very like context specific things. Like if I truly am interested in needs of the Caribbean region, then maybe I should have done my MPH at UE, right? Because then they
Mm.
would have more context and maybe more insight on the specific areas that were of interest to me. So even just thinking about like where you go to school and do you really have to go to school in the West? Do they really have the answers to the problems you're trying to solve if, that's not your region of the world and stuff like that?
Okay. And
Really, I started to reflect a lot and that type of stuff. Mhm.
do you know if UE, which is University of the West Indies, if
Mhm.
anyone was wondering, UE has a MPH program?
They do.
They do. Do,
Did they
do,
have it when I was doing mine? I don't know, probably, but they do. I looked it up afterwards. They do.
do you know
They
which?
do. And they have a PhD in it too.
Okay, I didn't know that. Which campus is it on?
All I think. Definitely Mona and St. Augustine.
Okay.
Yeah. Because remember, there's, I think, the Caribbean Epidemiology Research Center and stuff. They've got it all.
Okay, that's awesome. I didn't know that, so I'm definitely gonna look more into that. So thank you for sharing that. I'm just learning every day. Anyway, during your MPH, you were a researcher at Georgia Maternal and Infant Health Research Group. So how did you get this research position?
One of my professors at school, actually, he knew that I was interested in issues related to maternal health. And this was a project that he was working on. And he said, hey, well, if you're interested, we're always looking for students to help out. So I got involved. And that was a multidisciplinary team of both like public health students, medical students, and maybe some others too. And what we did is that I specifically interviewed doctors in rural Georgia. So I'd call them on the phone and ask them about what their experiences were. And for that, a lot of them, the challenge was that they were either the only obstetrician in the county and, maybe they were getting ready to retire and what the stressors on the system were as a result of that.
Yeah, I couldn't even imagine like being the only obstetrician in like this entire county, and then you
Mhm.
retire, and then there's no one to take your place.
Yeah.
That's a wild thought, but I'm guessing that's happening like across the
Mhm.
U.S.
Yeah. And sometimes not even that they were retiring, but they were leaving because it was stressful, right? And some have young children and families, and you can't just be called at all hours of the night. And so what we use that information to create state of obstetrics in the county cards. And so each county in Georgia, under like 159, got their own card with the state of obstetrics in their region. And all that was put together to go to like the Georgia State Senate for discussion on like, look, we need to do something.
It was some real life public health work.
Yeah.
Okay, that's awesome. Though, and that's definitely needed work, and it's definitely still necessary to this day as rural areas are struggling with lack of physicians, dentists, public health professionals, lack of
Yeah.
everything, infrastructure, money, taxes, everything in between. Um, so you after this position, you also had another position as a graduate assistant for the CDC, Centers for
Mhm.
Disease Control and Prevention. So how do you come across this position?
Well, it's funny. So from joining APHA when I was in my undergrad and participating in like the maternal health group, because APHA has all these sections based on your interest, I met two women there who were working at the CDC. So when I decided that I was going to go to Atlanta for my master's, I was always in touch with them. I spoke to them when I was trying to decide which school to go to as well. And so when I was looking for my practicum, they allowed me to come work with them. So see again, networking, meeting people, and they're like, oh yeah, you can come do your practicum here. So that was my practicum project. And I worked with them in the SUID, so sudden unexpected infant death registry. And one of the things that was going on, one project that was happening at the time is they were doing reverse site visits. So a site visit is normally when, you as the officer would go to wherever and check on things. The reverse site visit is when all the grantees come to the site. And so I helped set up the reverse site visit, and I created the facilitator guidelines and worksheets, and then did the evaluation of the site visit after to see how it was going. And then I also created a facilitator manual for new staff who would come on and need to manage the case registry afterward.
Okay, and what is the purpose of that reverse site visit?
For everyone to come together in one place and share their experiences with how they administer the case registry in their state.
Okay.
So, SUID is a form of infant mortality, and how are we counting it? How long does it take the coroner to get the reports out in your state versus my state? What can we do? Share best practices, stuff like that.
Okay, that's awesome. Awesome stuff. So then you graduated with your MPH and you took your global health concentration and you went back to Guyana and worked at in as a health education officer at the Ministry of Health in Guyana. So tell me about like that thought process of like you wanted to go back to Guyana, or were you thinking of staying in the US, or like how did that all
Well,
play out?
no, I wanted to go home. I wanted to be in Guyana or at least some Caribbean country. Winter is not my thing. So it's funny that I live in Canada now. And, my parents were there and stuff. So when school was finished and, oh, my master's, I found my master's like really stressful, especially doing my thesis. So I was like, oh, I need the comfort of my mommy. I'm going home. And so I wrote a letter, like a cover letter and my resume, and I sent it to the Ministry of Health, to the permanent secretary. That's who you normally send these things to. And there was no job. I just submitted it, and I figured I'd go in a queue. And then a couple days later, I got a call, and it was from the chief medical officer. Like my phone was ringing. Who's calling me? He's like, oh, I saw your resume and we need people. We're looking for someone just with your qualifications. Can you come in tomorrow for an interview? Well, sure, my calendar is open. Got nothing to do. I'll come tomorrow. and, and he's like, yeah, I've got this project. It's related to tuberculosis, stigma, and discrimination. And, like we've had the funding and we just need somebody to do it. Will you do it? Yeah, I'll do it. And so that's how I found it. Just an empty application, and just sent in, and someone saw it and had a project, and they're like, come on by, come on down.
Yeah, that is awesome. That is awesome.
Mm-hmm.
So what was that transition like to transition back from the US to Guyana?
It was fun, but it was different in the sense that like this job did not require a lot of intense data analysis and the types of skills that I learned in my master's program. But it also was a striking difference too, because like we learned SAS, and then they didn't have SAS at the Ministry of Health.
Mhm.
Like people were doing analysis with like Access and Excel. And so then again, it was kind of me questioning the relevance of my skills for the setting that I'm
Mhm.
in now. So fortunately, this was more health promotion, but again, these are the types of thoughts I have as I now analyze my new environment. What have I learned? What can I apply in this setting? And so, yeah, but I loved it. I loved being there because the Ministry of Health was the place that, in essence, served me, where you go to get your vaccines and stuff. So I really enjoyed being on the inside to see how it worked, how decisions were made, that sort of stuff.
Okay, that is really awesome. I'm glad that you were able to get into there. And that's one thing that I hear a lot about like people who they get their master's or whatever degree in the US or UK or Australia, and they go back to the Caribbean or Pan America or whatever you want to call
Yeah.
it, and they feel like their skills are like underutilized. And a lot, like I know in Trinidad, a lot of the government organizations, they don't work as efficiently as they can be, and a lot of people who do come back from like a more productive work environment, they go there and they're like, oh, just read a book, we don't have any work for you to do, and that kind of stuff. So it's glad I'm glad to hear that it was a rewarding venture for yourself.
Yeah, I learned a lot about me. I feel like I learned a lot more about my country as well, because one of my jobs was to write tuberculosis and stigma and discrimination materials related to tuberculosis. So like little booklets, pamphlets, posters with information on what TB is, how it's caught and how it isn't caught, with the hopes of, dispelling stigma, but then also getting to go and make presentations to schools, to churches, to sports groups. So I got to see a lot of parts of the country that I had not previously seen before through traveling to do this work. And it just really was great to give back to my own country. And so that was definitely fun. Yeah.
Yeah,
So
yeah.
not too much book reading for me. I also got to do health fairs, and I like it works for my personality, that type of dynamic. No 2 days are the same. You're getting to meet
Mhm.
different people. You're getting to talk to people, hear their concerns, how they feel about what you're saying, and why they may or may not believe what you have to say. I find that stuff fascinating.
Yeah, fair enough. And I feel like just generally for me, like one of the things I enjoy most about just going back to Trinidad is just talking to people on the street and
Yeah.
just hearing what they have to say. It's just most fascinating thing. You learn so many things just
Hmm.
from those kind of interactions.
Yeah. And you know what was funny? When I spent the summer with the guy at PAHO, one of the tasks that I had to do for him was entering data in EpiInfo. Like he would go to the hospital and get records, and then I'd enter the information in EpiInfo. And in my master's program, I think we did like a weekend course or something like very short in EpiInfo. And that
Mhm.
was like the one thing that they had in Guyana. But we spent several semesters on SAS, this big, fancy, expensive software that if you truly were going to be doing overseas work, was likely not going to be available to the settings that you were working in. So I thought that was a funny contrast as well.
Yeah, that definitely is a very interesting contrast there.
Yeah.
So after your role with the Ministry of Health, sorry, you moved on to become a technical assistance liaison at the Northrop Grumman Corporation. So first of all, where is North or where did you work for this position first?
That I worked in Maryland for this position. So Northrop Grumman is a large government defense contractor, and they make planes and things. So when I tell people that I was there, they're like, "What?" It's like, yeah, they had a really little public health section related to fetal alcohol spectrum disorder, and I was in the Maryland office. Yeah, well,
Okay.
Rockville. I think they probably had several.
Okay, so to talk to me about the transition once again back to the US. Like what was the thought process there?
I thought, honestly, I wanted to make a little bit more money than I was earning at the Ministry of Health, and just get like another type of experience. And someone I knew who was working there had said, "Oh, they're hiring. You should check it out." And so when I contacted them, it's funny that the recruiter was somebody that I had actually met at one of the career fairs during my master's programs. So it was almost already kind of like a familiar setting, like, oh, I've run into you before.
Yeah, that's awesome. And look at you. Your network is just so big and you don't even know it. I feel like some awesome stuff. Um, so what did you do in this role?
Okay, so it was related to fetal alcohol spectrum disorder.
Hmm.
And so, in that role as a technical assistance liaison, I helped create the request for proposals because we were going to have, so we got money and then we have to give out money to several sub grantees to do the work.
Hmm.
And so, I helped with grantees who were going to be creating programs in their community that would give women who suffer with like alcohol abuse or misuse birth control.
Hmm.
And so I had a group of subgrantees that I was responsible for, and I would do site visits with them. I'd be their point of contact if they had any questions about the program and that sort of stuff.
Yeah, and was there because I'm guessing you couldn't grant to everyone, so was there like a criteria that you had to follow to give out these grants, or was that process
Oh
like?
yeah, for sure. There was a criteria, and I I'm pretty sure it was written before I got there. And then we'd all sit around at the table and review and see, rank them. At least I think two people would rank each one, and then we take the highest ones and give them the funding. Yeah.
Okay, okay, awesome. And then after this role, you moved on to become a program technical support unit at ADRA International. So
Yes.
how did you come across this, and what is ADRA
Oh,
International?
ADRA stands for the Adventist Development and Relief Agency International.
Hmm.
So what did I do there in the program technical support unit? It was again kind of, so ADRA has several country offices. And so reviewing proposals from the country offices for feasibility and funding, also helping to write grants, because again, they would also want to apply for things at USAID or other places. So helping with the research for the grants, putting the proposals together, and that sort of thing.
Okay, awesome, awesome.
So it's kind of similar to the Northrop Grumman role, but also involved creating presentations to have ready on our different projects in case donors would ask and stuff like that.
Okay. And then after this role, you moved on to another role as a research assistant, project management and partnership at McGill University. And this is the role that you're currently in, correct?
No, that's the
Oh,
role just before the one that I'm
okay.
currently in.
You are right. You are right.
Yeah.
So you said that, considering that you said that you wanted to be in the south and you wanted to be away from the winter, what was the thought process to go to Canada?
Right. So that one was, I guess, really simple. So I got married and my husband was living in Canada and he didn't want to move. So I moved. Yeah.
Okay. Okay. So I'm guessing that proposition is
Mhm.
proposing came with a huge jacket, I would hope.
You know, it did not at the time, but that I did get one. He was very good. Like when I arrived, like I had winter clothes before, but he kind of laughed at my winter clothes. And so when I arrived, we did go to get me properly outfitted. He makes sure that I'm kept warm.
Okay, awesome.
Yeah.
So what was the job process like, looking for jobs, going from where you are to go to Canada? Like what how do you go about that process?
Believe it or not, indeed. So I I when I first came to Canada, obviously I wasn't working, and I was like looking on like I didn't have a network here at all. So I just, like, where do you look for jobs? I went on Indeed, I went on Monster, I typed in public health. And I had my eye on McGill because it's an English speaking university, so perfect. um, and so I saw this job and I figured I would apply. I never guessed in a million years that I would get it. And then they called and they invited me for an interview and I got the job. And I thought, oh, that's really exciting. I just, like, straight off the street on Indeed. Because they talk about all the applicant tracking system and all this stuff, like, but it worked out.
Okay, that's awesome. That's awesome. So what did you do in this job?
Okay, this was really very much like research coordinator work. So I would update the lab website. I would help the students get ready for their lab meeting presentations. I would help write the research. So, like when you have a research grant, you'll have to give like progress reports, midterm progress report, end of grant progress report to the funding agencies. So I would prepare those reports. I would help with grant writing, literature reviews, research ethics board applications, stuff like that.
Okay.
So it was very much a coordination role.
Okay. And did you find any difficulty in the transition from the US to Canada? I should have asked also.
A little bit. A
Yeah.
little bit for sure. The cultures are definitely different. And I would say, at least here, it's not as hectic, for want of a better word. I think, at least in my observation, there seems to be better work-life balance here. It's not as like go, 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 stay at work till midnight type thing. Yeah,
Yeah,
people seem to be a little bit more balanced.
yeah, and that makes sense. And is I guess does that suit your personality more?
Oh, for sure. For sure. 100%. Yes.
Okay.
Yeah.
Well, that's good to hear. I'm glad that you got to get into that role where you are in an environment that supports you and how you want to work better.
Yeah, I think balance is really important. And I also had a really great boss. I've been blessed to have awesome supervisors on all my posts, but he also would like we would have lab barbecues and stuff like that. And I guess it's part of being in a university setting too, that maybe might facilitate some of that. But he definitely helped support us in having not only socials, but in addition to doing the work.
Okay, awesome. And then after this role, you got promoted or moved into a different role.
So I moved into a different role because I felt like this was an opportunity not to be passed up.
Yeah.
So it was basically like a different section, and McGill started a School of Population and Global Health
Mhm.
in 2019. Well, the director started in the fall of 2019, and so with starting a new school, part of it is doing a strategic planning process. And I was like, oh wow, I want to be part of strategic planning. I feel like it's not every day you get the opportunity to be a part of strategic planning, especially strategic planning for a new school and a school of public health. And I just wanted to be in the mix. I wanted to learn how it happens. For my career, I know I want to change systems. I know that, you know, you can do what you can on the individual and that works, but like for real change, you have to do systems change. And so I thought that participating in strategic planning would help me understand a little bit about systems change, how systems change works. How do you get people to, coalesce around a common goal and that kind of stuff.
Okay.
So it's really something I wanted to jump at, like
Yeah, that
get
makes
my
sense.
feet wet with.
Yeah, and that makes a lot of sense, and it definitely is a great opportunity. So just to be clear, you were a project administrator for
Mhm.
the School of Population and Global Health at McGill University. What does that strategic planning look like, considering that you said it started 2 years ago? Not well, probably not even 2 years ago.
Yeah. So I started this position last year and it was just supposed to take a couple months. And then COVID happened, which derailed everything, which dragged the process out more. But I feel like we're finally coming to an end now and we'll probably be done in the foreseeable future, maybe another month or two. And then I guess the fun part would start in actually like implementing some of what's in the plan. But it involved lots and lots of meetings and retreats and setting up different working groups and trying to come to consensus on different things. And that is still in process.
So what do you think are like the biggest challenges for doing this kind of thing, starting up a new, like I guess planning and trying to implement starting up a new School of Population and Global Health?
Well, I think for this, or maybe for any organization, I guess it would be making sure that everybody's voice is heard, or at least feeling like their voice is heard. Um, so making sure that you talk to as many people as possible, and having those meetings where people feel like they can come and share. And yeah, I don't know, it's a big it's a big job, and it's really interesting to observe uh, how everyone that's involved in it handles it.
So what else did you do in this role, or was it just strategic planning stuff, or
Yeah, this this is still going on. So this is what I do every day. And mixed with other things. So like when COVID started, and the school started taking a role in COVID, working with them a little bit more on that and getting our response set up, and then moving back to strategic planning. And there's also involved, starting new programs and new degrees, and what's that process like, and researching how long it takes. Spoiler alert, it takes a long time. You have to get all your program proposals ready for each new course that you want to offer for the degree. And then it has to pass through different approval levels at the university. And then it will go to the Ministry of Education in the province. And you have to learn about building business cases. Like why do we need to offer this new degree? What other degrees are offered in the province, in Canada? Is there a value to this, and how do you establish that?
Okay. So is it going to be mostly focused on like Masters of Public Health, or are there going to be other
Oh, they
degrees
have
under
that
there?
degree already.
Okay.
They have PhDs in Epi, PhD in biostats, that sort of stuff. But it's now more like existing units coming together under one new home and then building and growing from there.
Okay.
So it's not like it was like starting from scratch. Things exist. Like how sometimes you might just have like a department, and now we're like, okay, well, we want to be like a bigger thing.
Okay, so it's more like centralizing all the different like public health things into one place.
Right, exactly.
Okay, that makes sense. Okay, and then moving on. So as everyone can see, if you're watching this on YouTube, you can see the wonderful background here for the Good Health Cafe, where Nikita is the host and creator of this podcast and blog. So tell me first of all, what is the Good Health Cafe?
Good Health Cafe is a place for candid, casual conversations that will empower you on your health journey. That's what the cafe is all about. And it's a podcast and a blog that talk about the same thing.
Okay. And which came first, the blog or the podcast?
I would say they came together. They came in parallel because I release every 2 weeks. And so on 1 week, I'll release the podcast. The following week, I'll release a blog that's related to the podcast topic in some way. And I keep alternating week after week like that. They started at the same time.
Okay, that makes sense. And which one did you think you would do more of at first? Was it more like, I'll probably blog, or I'll probably podcast?
Ooh, I don't know if I had that thought. I definitely think the podcast was the part that excited me more. I was really interested in talking to people and hearing people's stories and like sharing information, because one of the things that got me interested in this is that, just from talking to friends and family, I felt like people aren't as active participants in their health as they should be. Like, I would talk to I would ask, well, how was your appointment with the doctor? It was okay. Well, they gave me some medication. I'm like, well, how long do you have to take? I don't know. I didn't ask. And people feel intimidated, and they don't realize, I feel like they don't always recognize the value of being more active. And so I was like, I'm a health educator and I love this topic. Let me do something around it.
Yeah, awesome. So what sorts of topics have you dove into so far?
Ooh, I've covered obesity and weight loss, mental health, of course. I had an episode on collective trauma, which I thought was really fascinating. The menstrual cycle, tips on how to navigate your medical appointments, questions to ask your doctor. What else have I had? Let's see. Yeah, I would say that. Oh, urology for Men's Health Month. I had a urologic surgeon come on and talk a little bit about men's health issues. So it runs the gamut. I've had patients come, like I had a woman share her experience with scleroderma. And then I had another woman talk about how she advocates for her health in various settings. She has multiple medical concerns, and she spoke about how she navigates her health challenges, how she manages it all, stuff like that.
What are some of your biggest challenges that you've had with the Good Health Cafe?
I think one challenge that I have with the Good Health Cafe is social media. Though it's a millennial thing and we all supposedly know it very well, I do not. So figuring out algorithms and hashtags and things like that or like not my cup of tea. I don't consider myself a technical person. So that's been quite interesting to learn and navigate.
Okay. I'm just gonna put this out there. Would you be open to having like a student or someone help you or navigate or help navigate that social media thing with you, or are you just trying to do it by yourself?
You know, it never occurred to me. Yeah, if someone wanted to, sure,
All
call
right.
me.
Awesome. You see, you just got to make sure to ask them these questions on the podcast.
Yeah.
Now, everyone reach out to Nikita if you're trying to help her with that.
Yeah.
So,
But you know, fortunately, like there are like tons of websites that supposedly make it easy for you, at least like with Canva to help create your templates and stuff. So like that has helped a bit. And I learned about audiograms, and so I've started with that. But it's always like, what is this?
yeah, and it definitely takes time. Like Canva helps, but you still gotta like have the content to put on whatever you're putting out there. So yeah,
Exactly.
I know that feel. I know that feel. So I know you said that you wanted to start this to have like, I guess, casual conversations. But what really was the spark to, or like what was the moment that you're like, okay, let me do this blog, let me do this podcast, let me start this website?
Well, that's a good question. It definitely happened last summer. And, you know, I was learning a lot about imposter syndrome too at the time. And I would sit down and I'm like, why wouldn't somebody do this? You know? And then I realized, well, why not me? Like, what'd you go to school for if you have all these things? Like you're ready. And so I think it was really coming to the recognition that I had all the tools at my disposal to do something about something that I saw was an issue. And I feel like I had spoken to one too many people who would say, who I would know, like, oh, I'm not really feeling too well. Well, why don't you go to the doctor? Well, I'm afraid. What if they tell me something's wrong with me? I'm like, well, that's why you should go.
Yeah.
Yeah. So I decided, like, listen, I care about this. I had like we're all home. It's not like, you know, we're going anywhere. Why not start? Why not give it a try and see where it goes? And I've been loving every minute of it. I've been loving every minute of it. Like I learned so much from my guests and I'm learning so much myself, like just with researching different things. And I feel like this is something that I also have like lived experience in. We've all been patients at some point.
Mhm.
Like I even had the experience of dealing with my husband had gotten sick with a serious illness at one point, and so just even learning to navigate that because you never think that, oh, at like 29 or 30 you're going to be like seriously ill and in the hospital. And so even just as like a young adult figuring out, how do I manage all these things that they're telling me and all these big words and all these appointments? Like, what's the most effective way to do all this? And I learned so much during that process. And I'm like, I have things to share, you know? So I'm going to share it.
Yeah, and I think a lot of us absolutely have things to share. We just don't have, I guess, that push or that motivation or whatever the case might
Mhm.
be to say, okay, we should be the person to share this information.
Right.
And I think most of the time we should. And like don't doubt yourself. And like that's one thing like I always tell people who like want to get into like creating anything like on social media around like public health or whatever, put out stuff because you never know what's going to be helpful to people. Like a lot of the things that I might think are obvious are not obvious for other people. So just literally say it in plain English, and it will resonate with someone. So like everyone has something that they can teach someone, and even if you don't think so, there's something there. Just wanted to say that.
Absolutely, 110%. I agree with you fully, fully, fully. Because, like, so I feel like I ended up creating something that I wanted, something that I would use myself. Like, when I first started, like, having to deal with various illnesses in my family and stuff, it's like, I would have loved to have this. And now I've made it. And, you know, you always feel like, well, somebody else should do that. But, you know, why not you? So just get going.
Yeah, and absolutely. That's what I thought too with this podcast. It's like a lot of people going into public health don't know about public health until they reach like, okay, this is my master's. I'm not going to med school. What can I do? What can I do? And then
Yeah.
they find out about public health, and it's like there's so many different ways to get into public health. And I know for myself, it would have been great just to know about different opportunities, how different people like reached out to different organizations or like just different ways to navigate your career. And that's why I created this just to share stories of public health people, because we don't get enough credit. We're not in the forefront as we should be. And I'm hoping to change that.
Oh,
So yeah.
yeah, you're so right. And you know, like they say, when public health works, nobody really knows it's happening and all that. So it is good to put a spotlight on it. And I also liked when you said that a lot of the things you think are obvious are not obvious to other people. And I have that conversation with people so many times. Like somebody would tell me about some problem they have, and I'm like, oh, well, why didn't you just do this, or why don't you just do that? I never thought about it. What do you mean? It's it's obvious, you know, but we all have our thing, right? That seems
Mhm.
so natural to us. And like when I said social medias, for somebody else, it's probably like so obvious. But for me, it's this nebulous cloud, you know? So it's funny. And
Yeah.
I also am really interested and passionate, and I feel like enough of it doesn't happen, of just talking to people in plain language, in a language they understand. And I feel like COVID has highlighted that a little bit too, you know, where uh, public health professionals, researchers, they would get on the news and they're talking about stuff, and they're like getting upset when people aren't
Just
wearing
talking.
masks. And like, but what you're saying makes perfect sense to you. It doesn't make perfect sense to the rest of us. You know,
Yeah.
you're not using the right language. And I feel like that's so missed sometimes. Everybody's all about like I remember when I was in school, it's all about these research studies, and we go to journal club and we're talking about p values, and if there's enough people in the study, is it sufficiently powered? And I'm just like, yeah, like how much more counting do we need to do? We know it's a problem. Like, how are we going to fix it? Like, I don't ever remember reading about like, what was the dissemination program well done, and is it written at the literacy level that everybody gets? No. No, we didn't have too many discussions about that, but the p value was important.
Yeah, and I feel like someone I was speaking to recently was saying that like that's the problem when you get like a bunch of academics or smart people in a room. They just keep on talking about things, and there's no action or no solution. People just
Mhm.
keep on hypothesizing about all these different things. What if this? What if that? But no one's doing anything. So definitely get out there and do stuff, people, because we need more doing in this world. That is for sure.
Yes. Maybe that's why a PhD is like a doctor of philosophy in, because you know you're just like
Yeah.
thinking about higher level ideas. It's like action. I want to do. I want to do.
Yes, yeah, yes, definitely. So I know at the beginning of the interview I said that you have your PMP certificate, project management professional certificate.
Mhm.
So tell me a little bit about, because I know you have to meet like some requirements before you can take the exam. So tell me about that first of
Yeah.
all.
Well, the PMI website would be the best place to tell you about that. But if I remember, you need to have like at least a 4-year degree. You need to have like 35 hours of project management training, and then you need to be able to demonstrate in your prior roles like how you've met a certain number of hours of project management experience. So I did the project management training at McGill. um, and then, you know, I went over my resume, and then you go on the website and you kind of type in how much of each chunk of each category you've done, and then they evaluate your application and confirm that you can sit the exam. But you know, when you think about the fact that most things in life are a project, they have a defined end date, start date, defined end date. You know, it's easy to see where you have contributed in those different areas. And why do they do it? Because I like professional development. I'm always trying to think of new things to learn and new ways that I can improve myself. And in my research, it seemed like this was a good credential to have. And so when I started looking it up and I saw that I met the criteria, I was like, well, why not sit the exam?
Yeah, awesome. So what was the studying process like for this? Like how intensive was studying for it?
I studied a while and then I put off the exam because it was getting near and I thought, oh my gosh, I'm not ready. And so then I was, after I put it off once, and you have to pay to change your exam date. And so by the time the next exam date came, I'm like, I'm doing this. I'm not paying again to change it. But I basically bought a study guide and I read it. And by doing the 35 hours, whatever it was, of project management training, the course that I did, it so that was like teaching you and covering exam material, but then also included were three like mock exams. So I got the opportunity to do that. So I kind of studied with the course that I had to do, and then I studied with a book as well.
Okay. And what why would someone want to take their PMP certification?
Oh. Well, I guess to show a certain level of competence. You can also earn more money if you have a PMP. Um, I think those maybe the two biggest ones. Those
Mhm.
were the ones that I thought were interesting. Mhm.
Okay. Oh, and I actually wanted to like going back to the Good Health Cafe. I wanted to ask like, well, what benefits have you gotten from having this platform so
What
far?
benefits have I gotten from having the platform?
Hmm.
Ooh, I have gotten to meet a lot of cool people. I I think one of the things I love most about the podcast is the people I get to speak with. I enjoy when people text me and tell me, "Oh, I learned something interesting today. I'm really enjoying the fact that you do this." Um, I think it's also improved my network a bit. I got to meet people like you as a result. Um, so I don't know. I would say meeting people, the learning has been great.
Yeah, and that's one thing like
Mhm.
I tell people all the time, like a podcast is literally the best value play that you can pull
Mhm.
out because everyone wants to tell their story. You tell me you have a podcast and you want to be on it, like that's game over, really.
And I also learned too that the hardest part is like getting started. I can't tell you how long I ruminated over starting this podcast before I actually started. And now that I've started, it's it's not so bad. It's kind of like you build up in your head that it's going to be this huge monumental undertaking, and then you get going and you're like, oh, it's actually not so bad. It's not as scary as you thought it would be. So for sure I would say that. And something that I've also learned is there's value in putting yourself out there. So those are some of the learnings I've had from doing this podcast.
Yeah, absolutely. Like it definitely helped with your personal branding and like
Hmm.
no one like what I tell people like I have no clue who's listening to my episodes a lot of the times. People like randomly just reach out to me sometimes. I'm like, oh, okay, I didn't know you were listening or like this was happening or these kinds of things. So it is really interesting. And I just say that to say like you have to be proactive in developing your personal brand, whether that is having a podcast or just posting on LinkedIn or whatever the case might be.
Yeah, for sure. And it allows you to do your marketing too, which I think is great. Like if you do something through your job, then like there might be several um, layers of approval and stuff
Mhm.
that you have to go through. But when it's your brand, it's your thing, you have full control and autonomy. And I like that.
Yes,
I like being able
absolutely.
to, pick my guests, not necessarily having to censor them, or are you going to say something that's going to like offend this,
Hmm.
like the organization or whatever. It's like I really like that.
Yeah, yeah, I definitely agree too. It's good to have something outside of like typical work that you do. For
Mhm.
that is for sure. So where would you like to see yourself in the future?
Ooh, I would like to see myself continuing to pursue jobs that I feel help me to make a positive impact on people in society, where I get to make positive change. And I definitely want to help organizations I want to help organizations give people help work with systems and organizations to ensure that everyone receives quality, respectful care, compassionate and respectful care. That's a big deal for me.
Yeah, yeah, as it should be, and something that's been left behind for too long, and like
Yes.
we have to like fix these issues that should have been fixed like decades ago. But
Hmm.
here we stand, here we stand.
Yeah.
All right. Moving on to the last section of the show, the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Do it. It's a great field. There's lots of room to grow, so many avenues that you can go in. So I would say do it, but also be inquisitive, ask a lot of questions, do your research, like when you're picking your schools and stuff. See if you can talk to students that were in the program or professors to make sure that their research interests line up with yours and stuff like that. But definitely do it and explore and try as many things as you can.
Awesome. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I would tell them to network, put yourself out there.
Yeah, and I would also say never say never. Moved to the south to move to Canada, you know? You just
Yeah,
never
don't say
know.
never.
You just never know. Number three, what's something you're working on improving in your life right now?
Ooh, I would say maybe my mental health.
Mm.
Yeah, I had a psychotherapist come on the podcast one time, and she said, just like how you shouldn't go to a doctor only when you're sick, you go for like your checkups, you should do the same thing with a mental health professional. And I fully support that. Don't wait until you're like in crisis mode. So I'd say mental health is definitely something I'm working on.
Absolutely, absolutely. That's great advice there. And I feel like there's a huge stigma around going to a therapist or something, or because it's presumed that something is wrong, but no, and I feel like therapists should just be there as a regular like check-in visit kind of thing. You know what I mean?
Yeah, it's like a fun, no judgment zone. I think of it as, yeah.
Yeah, I think it just gives you perspective on yourself from
Mhm.
a professional viewpoint that you may not be able to like see just because you're in your life, you know?
Mhm.
Yeah, yeah. Number four, professionally, do you recommend anything besides your podcast?
I like that. I would also recommend joining a professional organization. I think they're great for building skills, for meeting new people, of course, but you also just get your feet wet in a lot of different things and learn things about your field that I would say at a faster rate than you could otherwise. Like when you're in your job, you learn stuff, but if you join a professional organization and you're volunteering on a committee, like you're building up a different set of skills as well. And so, of course, like American Public Health Association or Canadian Public Health Association, or the one I'm in that I spend most of my time working on is called the International Union for Health Promotion and Education, IUHPE. So, yeah, definitely find a professional organization that aligns with your interest.
Yeah, great advice. And last but not least, where can people connect with you?
Oh, everywhere. They can connect with me on Facebook or Instagram at the Good Health Cafe. They can find me on LinkedIn. Yeah. They can send me an email, info at thegoodhealthcafe.com. Yeah. So I'm easy to find.
Okay, great to hear. Well, I'm glad that I got to have you on the show tonight. It was a really good conversation, and I hope that a lot of people took a lot of value from it. So thank you for sharing your time.
Thank you for inviting me. It was fun.
Yeah, my pleasure, my pleasure. Well, I'm really glad that I got to have Nikita on the podcast today. My first Guyanese living in Canada. I don't think, I don't know if I would have another Guyanese living in Canada on the show, but it was a really great and insightful story. She has traveled and worked in a couple different countries, which I think was really great. If you have not, definitely be sure to go subscribe to her podcast, The Good Health Cafe. Look her up on Instagram at The Good Health Cafe, and be sure to just check her out there. I hope you all took value from this. Definitely subscribe, leave a review, leave a like, share this with a friend, share this with your mom. I would appreciate it. But I will see you all next week. Let me know if you all have any thoughts. You can DM me on Instagram at the PH Millennial, or you can email me, the PH Millennial at gmail.com. Look forward to hearing from you all. Have a blessed and great week, everyone. Peace and love. Public Health Millennial out.